system able to assist those who are infected?
Each state must have an emergency operation center of at least minimum 300 beds. Consumables, i.e. the PPE, face mask, and the rest of them will be made available to all the states of the Federation.
How are communities reacting to this COVID-19?
People still think that COVID-19 is from Western, that white people are more vulnerable. And in Burkina, for example, the community see them as rich people.
That misconception comes from a belief that only rich people can afford to travel abroad. Dr. Mumini Nayon of Burkina Faso says dispelling myths and providing accurate information is vital. Mudu hands off to an Ethiopian doctor working in New York.
What is your day like when you get to the hospital, briefly? What can you tell us?
When you walk into the waiting room, it's now an emergency room where you see patients coughing, complaints of fever and headache. When you walk into the emergency department, you see a lot of patients on a ventilator. We're running out of burial spaces that would have to start using park spaces for burials.
VOA's special town hall premiered April 8th.
Across the world, authorities are imposing unprecedented restrictions on citizens' freedoms in an effort to try and prevent the spread of the novel coronavirus. But human rights groups warn that some governments are exploiting the state of emergency to grab power. In a multi-part series, VOA establishes how even in established democracies, there are fears that the health crisis is being used to silence critics and squash basic democratic rights around the world. Henry Ridgewell with more details.
The extraordinary restrictions on basic freedoms are in most cases necessary to fight the COVID-19 virus, says Human Rights Watch Executive Director Kenneth Roth.
But sadly, we're also seeing governments that are actually much more focused on using the virus as a pretext to crack down on their critics and to consolidate their power.
In China, the origin of the virus, doctors in Wuhan tried to alert the world to the dangers of the new disease.
And the Chinese authorities, rather than heeding that warning, suppressed it. They censored them. They reprimanded them. And that gave the virus a 3-week disastrous head start, during which time it went global.
In the months since, normal checks on power in country after country have been suspended, warns United Nations Special Rapporteur Agnes Kalamar.
The court have far less power than they used to. Parliaments as well are far weaker under the state of emergency.
In Hungary, Prime Minister Viktor Orban pushed through emergency legislation in March with no time limit.
That basically allows him to rule by decree without any parliamentary oversight. It abandons elections.
Many countries have banned street protests.
If you think about the Algerian military-led government or President Putin in Russia, the Lebanese, the Iraqi governments, Prime Minister Modi in India, these are all governments that were facing big pro-democracy challenges in the streets. For the time being, those protests have to stop. Everybody understands that. But how long will the government maintain rules prohibiting that kind of free assembly just because it's convenient?
Police have been given extra powers to enforce a lockdown. In Kenya, a 13-year-old boy was accidentally shot dead. In Cape Town, police evicted dozens of migrants from a church. Footage emerged of police in India spraying migrant workers with disinfectant.
In the name of saving as many lives as possible, we are going to put the life of the most vulnerable groups at greater risk. History tells us that those moments are situations, moments where police powers is likely to be abused.
The September 11th, 2001 terror attacks on the United States are a case in point, says Roth.
That too was a moment in which people were fearful. They asked governments to protect them, and many governments, rather than doing what was really necessary to protect them, seized all kinds of extraordinary powers that it took a long, long time to relinquish.
For now, restrictions on our freedom are accepted as necessary weapons in fighting COVID-19. The fear is those restrictions could far outlive the disease itself.